Um, I will give you an overview of the next hour and a half running together this presentation. This meeting will be recorded and will be available for later viewing for reference and those unable to attend today. We kindly ask that you introduce yourself and your agency in the chat section, questions and answers at the end. If you have a question, please use the Q&A feature to type your questions. If you are joining us over the phone, keep in mind your engagement is limited. Mark Ondojani will kick us off with introductions and give an overview of the BHA, Behavioral Health Administration. Then we will review the program and eligibility information for each of the 3 grant opportunities. Contracting team, Kayla Martin, will give us an overview of the contracting process. We are expecting a large audience, therefore everyone has been muted. Mark?
Good morning and welcome everybody. I'm so glad you could join us. This is a very exciting time for us and we hope it is for you as well. These are some great opportunities. I want to start us off on this brisk morning by introducing my colleagues. I'll start with our division directors and I'll start with my supervisor first, Joy Hart, Division Director for Statewide Programs, TA, Innovation. And then Yumiko Doherty is our Division Director for Strategy, Planning, and Engagement. I'm Mark Onojani. I use he, him pronouns. I'm the Director of Adult Treatment and Recovery. We also have Paul Barnett, who's the Director of Child, Youth, and Family Behavioral Health. We have Wendy Simmerman, who's the Director of Workforce Development. Kayla Martin, who is the BHA Contracts and Procurement Manager. Ioana Egert, the BHA Procurement Specialist Team Lead, who you just heard from. And we want to give a special thank you to Sarah Lucas for supporting us in preparation for and during this meeting. Just briefly, an overview of what the statewide programs is. That division is where a lot of the work, a lot of the funded services that we operate work. There's a few different teams. There's the adult treatment and recovery team. There's the workforce team that Wendy leads. There's the child, youth, and family team that Paul leads. And there's also a criminal justice team that Jenny Wood leads. And there'll be a new team coming around care coordination in the future. Again, a lot of the services that will be funded through this opportunity will be managed by members of statewide programs teams. And we can, now I want to really give an introduction to who the BHA is. I think most of you already know, but the Behavioral Health Administration is a new cabinet member-led agency within the state of Colorado, housed within the Department of Human Services. And is designed to be the single entity responsible for driving coordination and collaboration across state agencies to address behavioral health needs. So we need to lead the coordination of behavioral health efforts across agencies by creating shared goals, improving collaboration, driving accountability and transparency for a person-centered, outcome-oriented behavioral health system for all people in Colorado. We need to provide an opportunity to streamline our overall system so that we are smarter about investing our dollars and more responsive to the needs of all people in Colorado. We want to elevate the needs of individuals and family members with lived behavioral health experience. We want to improve transparency, cross-sector data, and stronger accountability of the system. We want to address behavioral health disparities with equity central to the mission of the BHA. We want to problem solve and implement solutions through collaboration and effective relationships. We will engage the entire behavioral health system, including the commercial system, from prevention to recovery. We will enhance and focus on whole person care and improve the quality of care for complex populations. And we strive to be a diverse, inclusive, and equitable entity in vision, strategy, and operations. We can go ahead to the next slide. This is why you're all here, is to talk about this funding opportunity. So House Bill 22-1281 establishes 3 distinct programs. We'll go into detail talking about each. The first is a community investment grant program. Next is a child, youth, and family grants, and then a substance use workforce stability grants. This really is unprecedented times. Colorado's legislature recognized the significant need in the behavioral health system throughout our state. With funding from the American Rescue Plan Act, signed into law by President Biden in 2020, in 2021, let me get that right. We have a once in a lifetime opportunity to build out the behavioral health system to meet the needs of all Coloradans. I think, as all of us have come out of, or are still coming out of the impact of COVID, one of the things that I think we all recognize, and the data is showing, is that all of our behavioral health took a hit. Certainly for a lot of our young people, school closures and other impacts, not to mention the loss of life that happened during COVID. It's had an impact, but it also showed some flaws that existed long before COVID came. So this funding is an opportunity to both address the impacts of COVID, but also to build a better behavioral system for the future. So let's go ahead to slide 5. And I'm going to talk in greater detail about the Community Investment Grant Program. This has approximately $34 million. It's evidence-based, and it can be used for the following things: evidence-based or evidence-informed services along the behavioral health continuum. And this is really important. You can kind of read the slide itself. The legislation is intentionally very broad. And it's also recognizing that local communities are going to have a better sense, a better awareness of where those gaps really are and what types of interventions and services are going to have the greatest impact in their communities. So you could see all the different types of things, from prevention to harm reduction to treatment and recovery, including things like supportive housing and transitional housing. So it's very broad, and communities are able to identify what their needs are to come after it. Another benefit of this funding is that it does allow for capital expenditures. That's often rare, certainly with all of our typical SAMHSA funding. That's usually a prohibition. So these dollars being able to use for capital expenditures, when it's related to providing these services, is a real opportunity for us. And it can be used for expanding capacity of existing treatment. It's not just for creating something new, but it can be used to build out, to grow existing programs and services bigger. And it can also be used to create a program commonly known as treatment on demand, to prepare providers to offer same-day access, to initiate medication-assisted treatment, substance use counseling, peer support, and navigation services. Again, I think there's a recognition that we need to improve access and allow people to get the right services, where they are and when they need them. And this is the list of the organizations that are eligible for this funding. And the legislation itself gives definitions, certainly for the second one, community-based organizations. Local governments, a county, municipality, city and county, or local education provider. Community-based organizations, so a nonprofit or for-profit organization that provides behavioral health services. Federally recognized Indian tribe, and then nonprofit organizations. So pretty broad in terms of who's eligible to apply for these funds. With that, I'm going to hand it over to Paul in the next slide, and he is going to be able to talk to you about the CYF opportunities.
Thank you, Mark. Good morning, and thanks everyone for joining us. Again, my name is Paul Burnett. the Director of Child, Youth, and Family Services here at the BHA. I'm just going to cover 2 slides here that are specific to the Child, Youth, and Family Grant Program. They are similar to the community investment grants, but not exactly the same. We also have approximately $39 million for the years covered. So this slide shows the services that the legislation specifies could be developed with this funding. And I won't read all of it, but number 1 is to establish or operate child, youth, and family-oriented care access points. And it says that are physically connected to a family resources center. The legislation actually adds to that, or a facility that provides behavioral health care treatment to number 1. Number 2 is services for care navigation and care coordination. Number 3 is evidence-based or evidence-informed behavioral health care treatment, including substance use disorder treatment for children, youth, and families. Number 4, intensive outpatient services, including high-fidelity wraparound youth, mobile response, and expanded caregiver interventions. And like the community investment grants, this part also covers capital expenditures related to the treatment services listed in essentially in 1 through 4. So we can go to the next slide. Thank you. This slide lists the entities that are eligible for these CYF grants. And again, they are similar, but not exactly the same as the community investment grants. So number 1 is local governments, and we have the descriptions here. So that is nonprofit or for-profit. Number 2, federally recognized Indian tribes, judicial district, juvenile services planning committees, community-based organizations, nonprofit organizations, or local collaborative management programs. Thank you, and back to you, Mark.
Great, and I will hand it right back over to Wendy to talk about the SUD workforce opportunities out of this funding.
Wonderful. Thank you, Mark. Thank you, Paul. The Substance Use Workforce Stability Program, you'll note there's a little over 14 million. This is used to support direct care staff who spend 50% or more time working directly with clients. Their flexibility was built into the legislation as to how you can provide that support. You see here, it notes temporary salary increases, recruitment retention bonuses, and other tactics. So we encourage you to know the needs of your staff and how that fits into your organizational and strategic plans, and then, build in accordingly how you would use this funding. The eligible agencies include substance use disorder treatment providers or recovery providers, and including providers who serve children. Could we go back to that slide? Thank you. And local government. And then I do want to call your attention to the fact that the legislation requires us to prioritize providers who offer same or next day appointments, serve low income and marginalized populations, or intend to expand the number of individuals they serve. Next one. And then this just reviews again who is eligible for the Workforce Stability Program grant funds.
All right, so that turns it over to me. I'm Kayla Martin, she, her pronouns. I am the BHA Contracts and Procurement Manager, to walk you a bit through our process of actually applying to these grants. So this presentation covers 3 different grant opportunities. You can apply for more than one of the grants available, but you would submit separate applications for each grant. So if you're an organization that could use support for your SUD clinicians, but then could also have an idea for a new programming for children that's separate, you can absolutely do that. Just you will have to apply to each grant separately. We will post all of our grants and application instructions on the vendor self-service website. If anyone has ever bid on an RFA or an RFP through the state before, it's the same system. And then of course, this, like I said in the chat, this slide deck will be available for that link to actually, or it can be clickable. We are looking to post by next Thursday. So this is a bit of a departure from our normal, usually a grant posts for about 30 days, it closes, that's it. This is a lot of funding. We are going to actually keep submitting or keep accepting applications on a rolling basis. We'll in a second, we'll look at the schedule on the next slide, but we're going to do several rounds of awards until all the funding is awarded, or going all the way out to February 1st, 2024, whichever comes first. So we'll be taking, we'll be reviewing the grants in batches, as you'll see on the next slide, to sort of spread that out and make sure that people aren't waiting too long to get started. But that first group is not the only group that we anticipate happening. So you only need to apply once for the life of your project. So all work for all of the projects needs to be finished by December 30th, 2024. Right now, that's as far as we have spending authority for. But you only need to apply once for the life of your project. So if you know that between now and December 2024, you would spend $200,000, then you would apply for that whole amount at this time. If your application is denied, another great feature of our rolling application basis, you can request feedback from the selection committee and use that to sort of revamp your proposal and reapply. First awards are estimated to begin work by the end of April, this coming April. This could be a lot of volume. This is my team that'll be pulling this off, and we are already getting ready, but of course, like this is a projection, but we just looking at the circumstances of the year, we thought that end of April would be when the people who are applying in this first group would be able to start working. All projects, like I said before, do need to conclude by December 30th, 2024. And just like starting to say it early, we'll continue to say it the whole time, work can't start on your project until the final contract is executed, which means that we have a full contract that's been signed by you, by the BHA, and by the CDHS controller. The first thing you'll get when you know that you have won an award is a notice of intent to award letter. That is not a final agreement. That's us telling you we're going to start working on a contract with you. So we can't do any back billing. We only are able to start paying for services that occur as of the day that the contract is fully signed. So next slide. So this is our rolling grant schedule. So we're going to open it next week and accept applications all through December and through up until January 15th. We are anticipating that awards will be made by the beginning of March, and then leaving 2 months for contracting puts us at the end of April. So that these are projections, but these are just to give you an idea of, we anticipate there being multiple of these cycles occurring. I just put groups 1, 2, and 3 on this slide. We're prepared to keep doing groups all the way through February 1st, 2024, stopping that day just because if you're awarded on February 1st, 2024, there's not that much time left until December 2024. So we just want to make sure that everyone has enough time to do a meaningful project. Okay, and then I think that we're starting to see hands raised. Please do put your comments in the your questions in the Q&A, or hold until the Q&A portion. I just don't want to make you think that we don't see you. So thank you. All right, next slide. Grant writing assistance. I think so. I do think that Mark is not here. Oh, Mark is back. Okay.
I'm here. I got it.
It's not meant
Thanks.
yet. Okay.
Yeah. So again, I think the legislature was amazing in this, recognizing just as the BHA has a focus on equity and making sure that everyone has an opportunity to access these funds, they included in the bill that grant writing assistance would be provided. And the way we're managing that is through our partners over at the University of Colorado, the Colorado Consortium for Prescription Drug Abuse Prevention. They already had an existing grant writing program, That grant writing program had historically only dealt with substance use related issues. Since these grants are all across the behavioral health spectrum, we talked with them, and they essentially are able to contract with a number of grant writers, professional grant writers with behavioral health knowledge and experience. And so they'll be able to offer anyone that requests grant writing assistance for this project some support in accessing a grant writer and paying for that grant writer services. I believe we had limited it up to $5,000 for each of those opportunities. So, we're excited about it. You can see the eligible applicants: local government, nonprofit with operating budgets under $1 million and limited in-house grant writing capacity, and in good standing with the Colorado Secretary of State. At this time, for-profit corporations are not eligible applicants for the funding. The consortium prioritizes organizations located in or serving rural and frontier counties in Colorado, as well as small nonprofits in urban counties. So instructions for applying for grant writing assistance will be found in the RFA documents when it's released. And we can pass it over to Yumiko. We'll be talking about the toolkit.
Great, thank you so much, Mark. So the Community Assessment Toolkit, I think this is another exciting, innovative piece of all these grant programs. And actually, I should clarify what we're going to talk about here. The Community Assessment Toolkit only refers to the first two grant programs we talked about. So the Community Investment Grant Program and the Children, Youth, and Families Grant Program. So if you're applying to the third one around substance use disorder workforce, you can ignore this portion for now. In the legislation, it's stated that the BHA has to develop a community assessment toolkit, which will assist applicants in forming their application. So we'll be demoing that toolkit in just a minute here. But basically what the toolkit consists of is tools and resources for all of you to use as you're developing your application. The purpose is really so that you can utilize some of the best available data, that you can utilize some of the best practices and guidance around engaging with your community, that you can consider various equity considerations when you're putting together your application. And we also provide some examples of innovative approaches and programs that are used across the continuum of behavioral health. So this toolkit really provides resources and tools around all of those things for applicants to engage with and pick and choose and utilize what's most relevant to your community. It's important that when you read through the RFA that you understand that when you are writing your application, you will need to demonstrate that you interacted with some of the various tools within the toolkit in order to identify gaps within your behavioral health services for the relevant geographic area, and therefore formulated your application based on those findings. Similar to the grant writing assistance, we're very excited that we are able to offer technical assistance around utilizing the toolkit and the various resources within it for communities. I'll be passing things over to my colleague in just a minute here from the Colorado Health Institute, CHI. They will be assisting the BHA in providing technical assistance to potential applicants. And so as soon as we release the toolkit online, which we're hoping to do in the next couple days here, we will also have a simple form for you to fill out to provide some basic information to start the conversation around how we can provide technical assistance for you. I do want to emphasize as well that if you are in the position where your community has already completed a assessment of behavioral health needs, right? Whether it's a county assessment, regional, community assessment, and you've already utilized some of the best available data and stakeholder engagement practices to identify gaps in your behavioral health services, by all means, you can utilize that existing assessment, right? The purpose here is not to make you do more work or to duplicate work that is already out there. This is really to help applicants that really want to engage again with data-informed practices and community-led practices if those things don't already exist in an assessment. So with that, we're going to go ahead and pull up the actual toolkit, which is a web-based interactive tool. And I'll turn things over to my colleague, Emily Johnson from CHI, and we'll just kind of give you an overview of what that tool looks like and walk you through it. Again, we anticipate this being available publicly in the next couple days so that you'll have an opportunity to explore and engage with the tool prior to the RFA being available. So okay, thank you. Let me go ahead and share the toolkit here. And Emily, do you want to help walk us through what CHI has created here?
Sure, thanks, Yumiko. Hi, everybody. I'm Emily Johnson with the Colorado Health Institute. We have supported the work of the BHA in putting together this toolkit that Yumiko just described. So starting with this page, this is really just a landing page that describes a little bit more about the value of needs assessments, the purposes of the toolkit, et cetera. And from here, you can see sort of a map that will navigate the entire toolkit. It's broken down into two broad sections. The first is titled Measuring Access, and this is really where we want to provide resources to help get at those questions around where are my community's behavioral health needs, where across the state our behavioral health needs may be more or less acute. The second section, Making Investments, is intended to help guide you through a process of identifying what types of programs might be out there to help address some of those behavioral health needs that you measured earlier. So this is really a little bit of information around the continuum of care, so the really broad spectrum of services that fall under the behavioral health continuum. Examples of a number of innovative, effective programs across the state and actually across the country. A quick note, some of those programs are probably on this call. I have actually seen some of you on this call. These were just examples that we came up with at CHI. It is not intended to indicate favoritism towards any programs or others. They're really just to kind of help get you thinking about what types of services could be funded. And then within both sections, Measuring Access and Making Investments, we note some guidance around equity considerations in both data analysis and identifying those programs. So Yumiko, if you want to hit on the data button first, here is where we link to a number of different data sources that could really help tell that story. We start, the text at the top is really some guidance around how you can use data most effectively. Then in the blue section, there are links to some places where you might want to start just to see if some of these needs assessments have already been conducted in your community. We don't want people to have to recreate the wheel. So maybe you can, if you know, for example, that locally you have received a Communities That Care grant. 1 second, buddy, sorry. You might do some investigation into seeing, whether a needs assessment was already conducted on behalf of that. And if it was recent enough and applicable enough, it might actually suit your needs for this grant. If you can scroll a little below, then here's where we list, 20 or so data sources that can really help answer different questions around behavioral health needs and your population and disparities, et cetera, across the state. These all provide links to where you can pull those data to do some investigation, and they make notes in terms of what geographic granularity those data are available at, as well as the most recent year of information that's available. So Yumiko just returned to the main toolkit page, and if we go to the next section around community engagement, in addition to some of those sort of initial kind of quantitative data sources, there's also a number of ways in which you can sort of do your own research into your community and what you need. And so this just provides some guidance around that, whether that's doing key informant interviews, administering a separate survey, doing some focus groups. You'll see some sort of guidance here, and each of these areas will actually link to an external resource that provides even more in-depth recommendations on how to do these. And then finally, as I mentioned, we have that last section under equity considerations. So when you are reporting data, there are certain sort of best practices or guidance in terms of how you want to incorporate equity into that practice. So this, again, these sections all link to places where you can find more detail on these, but it's, for example, reflecting on imagery. If you do a Google image search for the word nurse, you mainly get women. Are all of the CEOs you're showing white men, and those kinds of thoughts when you're presenting those data. No naked numbers. So for example, if you're talking about a disparity in health insurance, don't just put those numbers out there. Also provide some of that historical context that might explain why we see those gaps. And so this, again, just provides some guidance around that. Under the making investments section, we start with just an overview of the continuum of care, or I should say a continuum of care. This isn't the BHA's official continuum of care, but this is really just intended to show the broad breadth of services that fall under a behavioral health continuum. So it could start with community-based prevention, it can start with health fairs, health promotion, and it could go to crisis services, inpatient residential care, et cetera. So really a wide range of services, and also across the lifespan can fall under behavioral health continuum, prenatal care to kind of end of life care. Yumiko, if you want to head to the examples. Oh, great, thank you. Then we also, as I alluded to earlier, provide some examples of different services across this continuum. They're bucketed into 6 categories. So whole person health, a lot of which is prevention. Housing, we know how important housing is for mental and behavioral health. Treatment, harm reduction, recovery, crisis services. And if you go into any one of these, you'll see some more definitions of what we mean. So let's just click on it. Yeah, whole person health looks great. What is included under this section of care. So for example, it could be trauma-informed training, et cetera. And then, like I said, we have a number of programs listed beneath that you can click on. It will take you to a site for that program that just shares some examples around some great innovative work that's being done around whole person health in this case. Those marked with an asterisk just indicate that they, I think, would also be really helpful for the children, youth, and families section. So they really have a specific focus on children, youth, or families. And then about almost the last section we have here is the equity considerations around designing those programs. So just thinking about, for example, like if we are talking about putting a service in place, are there going to be transportation barriers for people to access that? Are the services that you are proposing to offer as part of this grant opportunity culturally responsive, et cetera? So this just provides some best practices when thinking about program implementation. The final section of this toolkit is really just an FAQ that will sort of continue to be updated as more and more cues are frequently asked. Really around the goals of the toolkit, how to interact with it, et cetera. One thing we'd like to emphasize is that this is not intended to sort of be like published and done. This should be a living document. So as new data sources are identified or as new programs are identified, would love to kind of keep adding these to this toolkit to really make it a resource for not just this grant, but more broadly as people want to investigate the behavioral health needs of their community. So I'll turn it back to you, Yumiko. I don't know if I missed anything or.
Nope, I think that was great, Emily. Thank you for that walkthrough of the toolkit. Again, the purpose here, I don't want folks to feel too overwhelmed by this. The purpose here, again, is to make sure you have the best tools and resources at your fingertips to really inform your grant proposals, right? So we want to see proposals that are data informed, that have involved the community, and you've engaged with your community, and you've considered various equity considerations in forming your responses. So that's really the purpose here. Again, we're here to assist you and provide support around utilizing all of these resources, and all of this will be up and available on our website very soon. And with that, I will stop sharing, and I'm not sure who's up next. Mark, perhaps?
I think we are at that point where we are able to dive right into the question and answers. So some of the things we've typed, we know we have some people on the phone, so we can kind of go through all of the questions, and I'll ask my teammates to join me in trying to answer them. But I'll start right at the top and work my way through. So the first question we had was, does this include health systems or community health centers? And I would say, again, my understanding, if someone wants to speak up and clarify, that this question is, are health systems and community health centers eligible applicants for some of this funding? And again, looking at the eligibility criteria, it sounds like those would be included in community-based organizations based on the legislation and the definition. So I would say yes, would be my answer to that.
Yeah, I can chime in. I think this will take care of a good number of the questions that for community investment grants and children, youth, and family grants, community-based organizations is for-profit or not, so nonprofit or for-profit organizations that provide behavioral health care services. I think that's going to include the broad swath of people who are here. And then same thing for SUD. It's phrased a little bit different, but that applies to any substance use treatment or recovery providers. It does not distinguish between for-profit or nonprofit. And then it also specifically calls out local governments, which is going to share the same definition as the other two, which is counties, municipalities, cities and counties, or local education providers, meaning school districts, would also qualify.
Great. Thanks, Kayla. The next question from Beth, will these grants be directly contracted to the organization, or will it have to pass through MSO? And the first is correct. The BHA will contract directly with the selected applicants. Okay. And let me see the next one. The next couple questions were again about that December 30, 2024. I know many of you probably read the legislation and it had some reference to this 26. As Kayla pointed out in the answer, December 30, 2024 is correct. At this time, we only have active spending authority for these funds until that date. And the next question is really about the same thing. Do all projects need to conclude by that date, December 30th, 24? And again, hopefully they don't conclude, but our funding will have to end. It just means the BHA can't contribute funding to your work out of this grant funding until, after that date. We hope everyone will be thinking about sustainability in this work. Daphne, since work can't start till the award letter, does this mean that only new programs are eligible to be funded? Ongoing programming isn't eligible? And no, it just means that the BHA can't contribute funding to your work until the day your contract is signed is really all we meant by that language. So we will be, the selection process will select the best among the applications, and they may be organizations that are starting something brand new or growing what they're doing to better meet community need. All right, I'm moving on. Let's see. Are FQHCs, federally qualified health clinics, part of the broader nonprofit category? I think we addressed that earlier. I would say they meet that definition of eligibility for this. And do you have an easy link to the website where we can find the slides? I think Marina put that in the chat already for people to find.
When we don't have a link yet because it'll make a new page when we post it, but we will email all the attendees of the conference with that link.
Yeah, and I would think our website will probably kind of have notification of, hey, go to here. All right,
Yeah.
hope it will. So we'll be all set. All right. Allison Gottsman, thanks for joining us. Our primary care doctors who offer MOUD and recovery support eligible to apply for funding to support FDE, who spend 50% of their time in direct care. So I think you're referencing the workforce specific grant where that was needed. And again, I think there's some broad opportunity in terms of, who meets the SUD kind of workforce and what those, what those opportunities are. It's not restricted simply to a BHA licensed SUD provider, because it could be a recovery community organization, or in this case, it could be an FQHC or other healthcare providers that are working in the SUD space. Shayna Montrose asked about, can we apply for one grant in one round and a different grant in a subsequent round? Simple answer, yes. But also wanted to say, you could apply for 2 different grants in the first round. So if you wanted to apply for a CYF grant, as well as a community investment grant, you could do that in the first round. And next question from Sarah Blakemore, is this a reimbursable grant or awarded up front? And it is a cost reimbursement basis. So, as the provider incurs their costs and invoices us for those, we'll reimburse those. Next one was from Laura Gorman for the workforce grant. Our school districts, local education providers included in the definition of local government. I think Kayla addressed this as well. So local governments include local education providers, school districts for the SUD workforce grant. What's the maximum amount you can apply for? There is no maximum or minimum amount. Okay, let's see. Next question is from Laurel, and the Q&A thing keeps moving on me, so I'm scrolling back and forth. That's why I get a little distracted here. So are peer recovery specialists considered providers of recovery services? I believe, Laurel, this question is related to the SUD workforce grant opportunity. And so I answered it that way, but peer recovery specialists, coaches, mentors, they are a vital part of the workforce. If working in roles providing SUD services, they would be eligible for the SUD workforce grants. So hopefully that's addressing your question. And by the way, on all this work with peers, there's also other funding out there that's going to provide opportunities to get peers trained and certified. We really like to see the workforce get the proper training so they can excel in their roles and get them certified so that they've got that credibility to move forward. All right, Barbara Drake asked, are counties and human services departments included in the local government definition for children, youth, and family grants? It said local governments were defined as nonprofits. Kayla, you want to take a stab at this one? I think you addressed it.
Yeah, that slide was messed up where they were switched, but the question was, are school districts local governments?
No, this one is our counties and human services departments included in the local government definition for the CYF.
Yes, on CYF, the two, that and community organizations, the definitions were flipped, which is my bad, sorry. But yeah, they local governments would include counties and their associated organizations.
Perfect. All right. For the capital expenditure opportunity, does this mean that ground cannot be broken until a contract has been signed? Kayla answered it. We cannot contribute funding to any costs that are incurred before the day the contract is signed. If ground had already broken, our funding could jump in for costs that are incurred after the date. another part of this is that there is that desire for us to see some local match, particularly for a bigger project. Some of the smaller, like lower than $50,000 projects, there's a potential to waive that match. But if you've already got some local community investments to build a recovery center or a sober living home or a whatever, and so you've already begun the project, but you know you need much more funding, and you're applying for these dollars to do that. The big point is our money can't be used for anything until after the contract is signed, but you may already have other funding that's supporting efforts. All right, next one. Good morning. Can organizations apply for more than one grant in a respective grant program? For example, can we apply for 2 community investment grants as one agency, one for rural areas and one to address metro needs? And Kayla responded to this one, I think, perfectly. This might look more like one grant application that covers 2 different areas or projects. If the projects are very different, then maybe separate applications may be best. But if it's several locations of the same type of programming, one application could be fine. And can we get a copy of the PowerPoint from today is the question. Yes, it will be posted with the recording. Substance use workforce stability from Angie. Looks like treatment able to apply, didn't see nonprofits listed, or did I miss seeing that? Again, the SUD grant includes substance use disorder treatment providers or recovery providers, and does not distinguish between nonprofit or for-profit providers. So hopefully that helps answer your question, Angie. For the grant writing assistance, is the 1 million department specific. The applying entity itself must have a budget of less than $1 million. Entities with department divisible budgets may qualify based on the circumstances. Reach out to the CU consortium to discuss. And the next question is, do we have to be part of the BHE to apply? I'm not entirely sure what is meant by BHE, unless you're meaning like the behavioral health entity, which is a regulatory structure. And if that's the case, that's not a requirement for eligibility to apply. As we mentioned, there could be a sober living provider, there could be a recovery community organization, there's government organizations that are eligible. So if that's what you meant by the BHE, kind of a regulated service provider type, that isn't a requirement. All right. I lost my spot because some things moved, so. Okay, slide references for CRS 2760-5018. Can we look it up? And Kayla pulled that right from it. The full definition is local government means a county, municipality, city, and county or local education provider. Next question, are nonprofit institutions of higher education eligible, or would we need to partner with another organization? Kayla, what your thoughts on that? It seems to me that as a nonprofit organization,
I think higher ed would fit as long as it fit a category like on its own, like that you know, the community behavioral health provider. What is the exact language for that? The community-based organizations is just a nonprofit or for-profit organization that provides behavioral health care services. So if it's providing services, you fit there. Nonprofit, it could fit there. I was thinking if it was a not a nonprofit for
Yeah.
anything through that, but I feel like most universities are going to fit under local education provider if it's a public university, nonprofit organization, or community-based organization.
I think they would. So yeah, again, there's a lot of services that could be offered on to college age kids, college age adults. Let me be better there. And so yeah, I think that's a great opportunity. All right, next question. Is there a way to get a copy of the questions and answers at the end of this presentation?
We're looking into that as a group right now. We have, the Zoom says that it is transcribing. So we assume that means it's going to download a text file for us. So if, assuming that is the case, that will get posted along with the slides and the recording.
Thanks, Kayla. All right, if you use an assessment that has already been developed to identify gaps and address them in the application rather than using the tool, how does that requirement get met in your application since use of the tool is required?
It doesn't have to be that tool specifically. It just has to be a tool. So you would just need to identify what the tool was that you used, and we may ask to see the results of that.
Yeah, there may be a show your work aspect of this, right? But yes, we know that there are other things out there, and so we wanted to create this tool for those that wanted to use it. We think it's a really cool process to go through, but many communities have already used a process, and as long as you've got that information, you'll meet that requirement. Okay, can you send out a link to the websites where the grant information will be posted? Yes, we will definitely be sending that out. Make sure you get our emails. That's a key thing. If a local community needs assessment was completed in 2021, will this be considered new enough, or will we need to pull in data only from 2022? Obviously, the newer the data, the better, but we also know if you've invested in an expensive local community needs assessment, that you're able to update, with some new data points. I think that would probably be relevant as opposed to having to recreate the whole thing. And the next one is really looking at the health professional shortage area sites eligible. Again, if they meet those definitions of eligibility, I don't see why they would be excluded. What is the estimated award amount for each grant category? I would say that we don't have an estimated amount. I think it's going to be wide ranging based on the type of applications we receive. Again, we might get some very, small grant requests, and then we may have some larger ones. So we're not saying we're going to give out X amount of grants all worth 150,000. We're not setting a dollar amount because it's going to be driven by what your need is, and what those costs are. For grants that support capital, would it be able to cover a portion of the cost of a new electronic health record? Kayla, any thoughts there? I think
yes, I think I answered that one too. So yeah, I think that could be a qualifying capital expense.
Good. Yes, that'd be thank you. All right, and then the next one, under harm reduction, can domestic violence offender treatment qualify? The impact on families, mental health, and communities are significant. Again, I would say that anything across the behavioral health spectrum would be eligible. Again, you're gonna, like anything, you're gonna be wanting to talk about, what kind of support you already have, what's your sustainability plan after this investment of funding goes away. Those sorts of things need to be addressed. Okay. Next question, any opportunities for de-escalation training for law enforcement, or the longer 40-hour crisis intervention training for first responders. And I would say exactly what Kayla wrote. I was going to say the same thing. We do have another grant opportunity, HB-1281, Criminal Justice Early Intervention, that is also posting on December 8th. It sounds like it might be a greater fit for those types of projects, but the community investment grants could also fit. So there's another whole grant program that's eligible that's really focused on the criminal justice population, and really looking at diversion and deflection type of programs. So look into that one. Again, same email. We'll be emailing out when that grant opportunity is released as well. Can we provide a text version of the Q&A for reference? As Kayla mentioned, we're working, Zoom tells us they're transcribing. We'll see what that transcription looks like, and we will make sure to include that to the degree we're able to. Regarding the projected rolling grant schedule, is this solely for the SUD opportunity for all 3 grant opportunities? If it's not for all 3, can you please speak to the deadlines for the opportunity 1 and 2? And it is for all 3 grant opportunities, okay? And then is there a specific percentage or amount of funding that will be granted out in the initial funding cycle? Can you confirm that there will be second cycles, or is it possible that all funds could be granted out in the first round? No set percentage, so it is certainly possible, however, unlikely that all funds could be awarded in the first round. So I think the key point is, if you've got a project in mind, if you've done that needs assessment, apply early. I certainly don't wait for the third opportunity because who knows, hopefully by the second opportunity, we are releasing most of the funds so that these dollars can be put to use in community. Yeah.
Hey, Mark, can I interrupt really quick?
Yeah.
Just going back to the question about additional funds available for de-escalation, law enforcement, and et cetera. I just want to remind everyone that we do have other grant opportunities that have not been announced yet. HB-1281 provides funding for peer support programs in grants. There will be career pipeline, career pathways, opportunity grants, and it also allocated funds toward the development of training specific to law enforcement. So just be aware that, this is an unprecedented investment in behavioral health for the state of Colorado, and what you're seeing today is one piece.
Okay. And I am going to ask that Kayla take over on fielding the Q&A, as unexpectedly, my son had a 2-hour delay and it is now time for me to drive him to school. So I apologize that I will be stepping away. I may be back while you're still going, but Kayla will continue on. Thank you all.
Thanks. And I may call on Joy and Paul and Wendy here as if there are sort of clinical questions. So where do we leave off? I've been answering in the open to give keep up. So are we with
Kayla? I think you're under answered, and it's the question I think that Daphne had since war
right
can't
at the top?
start, I
Okay.
believe. Yep.
So since war can't start until the award letter, stop pausing right there. It's not the award letter. Very important. You'll get your award letter first, and then we start the contracting process. So funding can't start until the signed contract. The award letter is a very fun step in there, but it is not the award. So there's that. But so since work can't start until the contract, does this mean that only new programs are going to be funded, aka ongoing programming is not eligible? Not true. It is eligible. It's just that we can't start contributing our funding, but if we're going to be coming in as a funder of an existing project, that is qualifying. Moving forward, regarding the projected rolling grant schedule, is this solely for SUD or all 3 opportunities? It is all 3 opportunities. Is there a specific percentage or amount of funding that will be granted out in the initial funding cycle? So It is possible, however unlikely, that funding could all be awarded in round one. Round one is not very long. It's only about 5 weeks of applications. It's over the holidays, and there is $140 million on the table here. So as the procurement manager, I would be really shocked if it did all get awarded out in the first round. But what we wanted to avoid was having, if there were some, great qualifying proposals that we just ran out of room in that first batch to fund. We didn't want them to have to reapply and then our scoring committee to have to rescore. So for that reason, we did not set a maximum percentage. Early bird is good, although I definitely am anticipating that there should be more than one, although I cannot promise. If we are requesting funding for a behavioral health gap analysis, can the funds also be used to implement strategies identified from the gap analysis? I think that is, so yes is the short answer. I think you just want to find a way to account for that in your budgeting, like how much you're requesting in the grant award. Is there a maximum grant amount you can apply for? No maximum or minimum amount. Do we have grant writing resources that for-profit agencies might use? None at this time. The consortium is limited to nonprofits and governments. What is the difference between community health-based organizations and for-profit SUD providers? So this is just about which grants eligibility criteria you're using. I think they are the same. If you're looking at CYI, the Children, Youth, and Family and Community Investment Grants, that distinguishes those types as community-based health organizations, but the SUD, the Substance Use Disorder Grant Statute, doesn't use that term. It just uses substance use providers, and it does not distinguish between for and nonprofit. So they are all equal in terms of the eligibility. So answers next two. Any bonus points for collaborations? No actual literal bonus points on the application, although we do really like having those for collaboration and coordination in the community, and also for the reduction of administrative burden on both ends. But there's not a point differential for applying as a collaboration. But as a contracts manager, I would really love it. What opportunities? So now I'm moving to the open section. So I haven't typed answers to these ones yet, but we'll just go through answering them verbally.
Kayla?
Yes.
I'm so sorry to interrupt. I also have about 6 questions that came from the chat. Do you mind if we address those before we get to the other 54 questions we have that are still open?
Yeah.
So the first question is, where do you go to apply for these grants?
So the website is easy to report verbally to start. It's bss.gov. So that is a landing page for what is called vendor self-service. And that is, there's an extra link to click in there to get to the actual platform. You just click view as like public access, and then that's the platform where you can search for grants. So we'll have the, as of next Thursdays, when you can pop onto there and search for, you can look for all BHA grants, you can look for these grants by name, by number, which is 1281. Any of those will work.
Thank you. I also, if I could just remind everyone to please utilize the Q&A feature for questions, because I'm seeing them come in the chat and they're not going to make it to them. So if you could please put them into the Q&A, that would be great. Next question that came in the chat that I just copied is, what is the website where all of this will be posted? And we just kind of answered this, but this was during the presentation on the toolkit. I'm assuming it was about the toolkit, and the answer to that is that will be posted on the BHA website soon. And I posted our BHA website as well in the chat, so hopefully that came through. Next question, does the agency have to already provide behavioral health or SUD services?
Yeah, sorry, can you repeat that one more time? I got distracted about looking in the chat.
Sure. Does the agency have to already provide behavioral health or SUD services? I'm assuming before they apply, like would they?
Right, that's a good question. I think if the grant is setting you up to become a behavioral health provider, then you are applying as a behavioral health provider, as a prospective one. So I believe you would still qualify.
Okay, thank you. And then someone said, would you mind popping back to the slide on what community investment grant can be used for? So Ilana, if you could go back to that slide, that'd be great. Same for the CYF grant slide. If we could just give a little bit of time on both of those, and then continue to answer the questions.
One more.
Next question. Here we go. Next question. As a community, we collaborate regularly, especially regarding behavioral health continuum. Would it be more beneficial for organizations to apply together under one application, one applicant for one funding area? Often that complicates the project as because it's difficult to explain multiple collaborative projects together.
I think I will leave this to so mostly it's, as far as the rules go, there's no one way that is going to get you more points or is more or less eligible. I think that in general, I would leave that to organizations sort of as a strategy decision.
Thank you. Can you apply for the SED workforce grant to start a harm reduction / peer support program?
Yes, I did hear Mark saying that is within the realm of treatment and recovery.
Okay, perfect. I tried to register on the VSS website and it asked me for a DUNS number. Is this essential or can we use a TIN or EIN? Do we have to register on VSS to submit an RFA?
So we do, DUNS numbers are actually defunct, which I think that just happened in April of 2022. You will need eventually what's called a SAM.gov, which is System for Awards Management.gov. Well, the website is SAM.gov. You'll need a SAM unique entity identifier in order to hold a contract with us. For the time of registering on VSS, is Raven Lopez here? I do not know if we invited her, but
no.
I think that so my understanding is anyone can look at VSS without having an account. You just click the public access instead of logging in. I don't even have a VSS account. I do it by that public access link. And then when you actually submit a application, it's through box.com and there will be a URL to submit through there. So I believe you can do it without registering on VSS. Registering on VSS's benefit is that once you do that once and click basically all of your affinity areas that your organization works in, you'll get automatic emails anytime there's a procurement opportunity. I think you should be able to do it without VSS, but I will encourage everyone to get set up with a SAM.gov unique entity identifier number because we'll eventually need that for the contract, which is what replaced DUNS numbers. So you couldn't get DUNS numbers right now if you tried. So I think that's just a state government website taking a while to catch up to the times.
Thank you, Kayla. We can get back to all the open questions still in the Q&A, and you can start right at the top.
Okay. What opportunities do we need to use the tool in writing an application? I'm not sure I understand. I think in general, what the toolkit is for is to identify a gap area, and we want to see that your project is working within that grant area, that gap area, and the application is going to ask you sort of what did your tool find and how can you, how are you addressing that with your proposal? So if that did not answer your question all the way, Tara, then feel free to pop another sort of elaboration in the chat or in the Q&A.
Yeah, Kayla, this is Yumiko. I would just, say in your application, you'll explain which of those resources you used within the toolkit, right? So you would cite, for example, which of those data sets you used to come to the conclusions of these are the gaps within our community and therefore, right? This is why we've designed our proposal this way. So kind of walking us through the logic of how you utilize those resources within the toolkit to come to your conclusions.
Muted myself. Okay, so legislation indicates matches may be required. What counts as match specifically as in kind? And what does it need to be contemporaneous or past, or do past investments count, and how far back? So the match requirement is that if you have an organization with a budget, anyone who's applying for less than $50,000 will not have to provide match, regardless of your organization size. If you're applying for more than $50,000 for the life of your project, then if your organization budget is less than $20 million, you'd have a 2.5% match, and above $20 million would be a 5% match. So 5% is the maximum. Parts of this I partially want to answer possibly offline, and I don't know if we've mentioned, but we do have 63 questions and 20 minutes left. Any questions that are not that we don't get to today will be posted along with the RFA as a Q&A document, which is also, when you have questions, once the RFA posts, you'll submit questions to that Q&A document as well. So Allison, I'd like to take some time to research this question more specifically before answering. So we will, can you make a note of that one for our Q&A? Or since you're sharing screen, should I have somebody else grab it? Marina, can you grab that question for a separate document?
From Allison?
Yes.
Kayla? Okay,
Yeah.
I got it.
Okay, thank you. All right, next one from Allison. Page 6 of the legislation says Child, Youth, and Family Services have a goal is to have a care access point in each BHA region. What are the BHA regions and where are they listed? I think that corresponds to our ASO regions. So where the crisis services regions lie, which is also the RAY regions. So that is available on the BHA website. I will not get a link right now while I'm talking to you all, but if you look under the crisis network, then you'll see the BHA region map. We aren't a treatment center, but we employ peer recovery specialists and care coordinators who work with clients with SUD. Are we eligible? My read of the statute is that that would count as a direct care staff treating SUD. So that would be a yes. Does behavioral health include dementia and Alzheimer's, or only substance use related programs? It's not only substance use related programs, it is mental health related, although Joy, I think I need to defer to you on whether conditions like that are under the mental health umbrella.
I think when we're talking about these type of programs, it's really, what kind of services are being provided, treatment related, clinical. So it's not just driven by a diagnosis.
Right, so like if it was a depression or anxiety associated with dementia and Alzheimer's, that's definitely our wheelhouse.
Yeah, if people are providing behavioral health services for those individuals, then I would say that it would qualify.
Agreed. Can capital grants go to projects that are already underway and not yet completely funded? Would a nonprofit healthcare facility be eligible to, I think those are slightly different. So first one, we can contribute to a project that's already underway. It's just that we can't back bill it all. So you could only start using our funding for expenses that were incurred after the contract was signed. Would a nonprofit healthcare facility be eligible to apply for funding for the behavioral health suite within the building? Yes, that's a pretty straightforward one for behavioral health services. MAT and counseling services are offered within. Great, love it. Bridget Sanchez, who decides who are the awarded grantees? And is there a type of rubric for what factors will be considered in deciding who gets awarded funds? Yes, we'll have selection committees for each grant, for each round. They're right now, so I'll refer everyone to the statute to see, you can see exactly who, what kinds of people are on the selection committees. Right now we're building those committees up, but the application itself is really straightforward to how many points each question will earn you, and any applications earning past a certain number of points should be awarded. So yeah, I think the RFA itself will really have that in good detail. I correct that for children, youth and families, school districts would not be eligible. They would be eligible. The CYF slide was messed up where if you look at number one, local governments, that number one and number four are switched. So, and that was definitely exactly me who did that. So local governments means a county, municipality, city, county, or local education provider, which would be a school district. And then a community-based organization means a nonprofit or for-profit organization that provides behavioral health care services. Okay. Would a neighborhood primary care practice that employs LSCWs and mental health counselors and FNPs prescribe and offer mental health counseling daily to all patients, including Medicaid patients, be considered for grant funding? I would read that as a community-based organization providing behavioral health care services. So yes. You say the law says whole person care. Regarding gaps, you mean gaps in behavioral health services or gaps in services to behavioral health patients? Legislation has both. Housing is on the list. So going back to the Yumiko, do you have anything to say on this one of what kinds of gaps we can fund here?
So it's a mix, right, of what are the, you're going to identify what behavioral health needs are unmet within your community and how those needs would then align with these various solutions along the continuum. So I think it's that combination, right? Kind of justifying what are the gaps and then how can you kind of address those gaps? And again, this is meant to be very broad and open-ended in terms of how the continuum's defined. So hopefully within one of those options, you find a solution that meets the needs of the local community.
Yeah, and for example, I see transitional housing and supportive housing specifically called out. So, and recovery homes. All right. Emo says, thank you. Anonymous attendee collaborations. Oh, I think that was with the question about, do you get extra points for applying as a collaboration? So not extra points, but just brownie points with Kayla, and also good for your community as well. But there's not additional points on the application for that. Can you use this funding to continue existing positions or programs? No, we can, especially the substance use workforce grant in particular is really called out for that, for supporting staff that are already there. And there's examples in the statute and on our in the RFA about what kind of support that we can provide. As a community, we collaborate regularly, especially regarding behavioral health continuum. It'd be more beneficial. We just talked about that one. More beneficial to apply as one applicant or one funding area. So yeah, I think we actually answered this one all the way. So let's skip over that one. What are the dates of funding? We are anticipating the end of April for contracts to be executing, in this anticipation. If there are hundreds of qualifying applications, this is going to take a little longer, but that's what we're shooting for. So a little bit of this fiscal year 23 left, and then the end date right now is December 30th, 2024. So not a super long window. So next question, if you're applying as a collaborative management program, one of the signing members also applies, would that disqualify either? No, because I think any agency can apply for more than one grant, so that should not cause any issues. Once intent to award is given, does the BHA or funding services continue to assist the program? And is there a follow-up by BHA? So funding does not kick in until the contract is signed. Notice of intent to award is only telling you we're going to start working on the contract. So our funding only goes, like I said, through if you refer to the grant application cycle, whenever your group's contracts are executed. So not everyone's will execute in April. If you apply later than that, it'll be later. The funding can only go through December 30th, 2024. So we can't continue funding with this grant funding, although there are, getting involved in this grant and on VSS and everything sets you up for other grant opportunities. And then I think one thing we're excited about with this grant is bringing in new providers into the network. And so that sort of establishes a relationship and sort of puts you more on the radar. But as far as the formal term for funding and interaction with us is from the date of your contract execution to December 30th, 2024. Is there a required match? Yes, I did go over it verbally. We don't have a slide on it right now, but it will be detailed in the RFA that is posted next Thursday. We have a federally negotiated indirect rate letter from SAMHSA. Can we use this for our indirect rate? I think the statute limits indirect rates to 10%, which is the only time when we don't accept federally. Usually we do accept federally negotiated indirect rates. I think, a grant recipient may use no more than 10% of a grant award for administrative costs associated. So unfortunately, we are limited to 10% for this grant opportunity. If you are not granted an award amount, you lose out on grant writing funding as well, correct? I don't believe we would have a way to do that. I think you applied for grant writing funding and that, so you're not applying for funding, you're getting engaged with the grant writers that we've contracted with, who are outside the BHA, they're at the CU consortium. So if your proposal was not awarded, I don't think that would have any consequences for you. We would have already paid for that service and you would have already received it. We do not have links to the RFPs yet because they are not posted. So they'll be posted next Thursday. Regarding capital support, you said there's no maximum in funding. Does that apply for capital as well? No maximum. There is no maximum, although once we get to a capital project over $1 million, there are some additional hoops to jump through with this being COVID stimulus, American Rescue Plan Act dollars. They are closely monitored, so there are some extra reporting and justifications that we have to go through. So that can delay the start of your project potentially because we would have to take that specific project to the governor's office and the Treasury Department to get approval. So just being aware for that. We got Mark back. Yes, all 3 grants are a cost reimbursement basis. Does the budget requirement for grant writing help me? It has to be under 1 million for the entire county budget. When this was asked earlier, counties and like the university system were kind of the ones that I was thinking about could be considered on a case-by-case basis. The statute just says the entity has to have a $1 million budget or less. And so it'd be kind of making a case for what counts as an entity. So I think we need to look at those case by case. If so only some of the grant is considered a good fit, will we fund part of it that it is a good fit? Yes, this would be a good thing to call out. It is possible that the grant selection committee could love aspects of your proposal and not others, and then sort of come back with a counter proposal of we'd like to fund part A, but not part B. And that would be up to you to decide to accept or decline. Adams County has a new community-based service building for youth and adults on South Platte Road in Commerce City. Yay, that's great. Does each organization in that building need to apply for these grants, or can the main director of the C4 program apply? I think that goes pretty well with our, what was asked earlier of, would it be better to apply all as one thing, or if they're different projects? So like that advice of if they're very different projects, applying differently could be better. But if it is really just, if it makes sense to apply as one organization, you can. So there's no hard and fast rule. It's sort of what makes the most sense for your organization and for your strategy. Can in-kind resources be counted towards a local match? Yes. It's a little shorter answer than what I owe Allison. If a local community needs assessment was completed in 21, we did answer that one earlier. That we understand that these are expensive, and 21 to me does not feel ancient. So I think we could accept it 21. We will be sharing this presentation and the links to the website will be in a follow-up email. Where can you see if your community has had a local needs assessment done? Yumiko and Mark, do you know that?
The
Sorry,
local
can-
public. Go ahead, Yumika. You can go first. Or whoever.
I was going to ask to repeat the question, sorry.
Got it.
Where can you see if your community has a local needs assessment done?
And Yumiko,
yeah.
I was going to chime in. A lot of the local public health authorities, you go to their websites and they will often have done some sort of community needs assessment.
Yep.
And most of them are addressing
Oh, Mike froze.
the regional groups that have dealing with the opioid settlement funds have also may have already done some of their work. So that's another good place to kind of check in with that group and see what they've already come up with.
Yes, exactly. And I would say for your local community on the toolkit, we give some of the top examples of assessments that likely your community has engaged in one of them, right? Not all of them are required. So it's going to have to be a conversation with some of your key partners and stakeholders to identify whether which of those programs or assessments your community has engaged with. But we do provide some examples on the toolkit, and the two that Mark mentioned are great examples as well.
Awesome. What are some examples of capital expenses? So capital expense is anything that gains your organization a fixed asset, something that's going to endure in life and usefulness. So shorthand is anything that's like a building is an easy capital expense. Vehicles, so equipment over $5,000 is our threshold for what's considered capital, and that does include software. So when someone asks about buying an EHR, that's going to probably be more than $5,000. So that counts as a capital expense. The legislation says that a grant recipient shall receive any money, let's slow it down. A grant recipient shall spend or obligate any grant money by December 31st, 2024. Any money obligated by December 31st, 2024 must be expended by December 31st, 2026. Very well aware of this part of the statute. We took this to our audit division and to a state controller's office, and the issue was that this was inconsistent with the appropriations clause of the bill, which only appropriated the funds to us until December 30th, 2024. So that any money obligated must be expended by December 31st, 2026 was invalid because of the appropriations clause. So that's something we're aware of, working on, but right now the only thing that we can commit to is December 30th, 2024. Angie Bertrand, are there match requirements on each grant? Yes, which you can look at the details on the grant itself. And yes, I agree, in-kind does qualify. And I agree, Yumiko and team have been doing great on the community assessment toolkit. Secure transport vehicles do qualify as a capital expense. I think I just did the reasoning for requiring money to be spent by then is that is all we have spending authority for right now from the legislature. As a capital expense, would the purchase of a building or facilities be covered by this grant or down payment only? As long as it's within the funding period, we could contribute funding to any part of that. We do not have I've got 2 more minutes. I think I might try to get 1 or 2 more questions, but then we'll go over just sort of next steps for that. So how will success be measured? Are there specific performance indicators that will be collected for reporting? Is there a plan for projects and success, how they will be shared with the public? These are American Rescue Plan Act projects, which means we will be setting some common performance indicators that will get reported on the governor's dashboard. And in that sense, this is a pretty coordinated effort, but then I think the application also there's a chance for you to say, what are your performance indicators? And so I think that a lot of this, like for the awarded vendors, is going to be a conversation with the BHA. We love to show off the great work you're doing. So once we know what that work is, we'll have a little more information to go off of. Will proposals be reviewed as they are received or only after the proposal deadline? So we're going to be handing them, because of the volume, we're going to be handing them to the selection committee to read as we receive them, but we will only be awarding in batches. So if you turn it in super early, it'll get read early, but it's still not going to be awarded or declined until the end of that period. This one is short. How do we receive notification of a grant opportunities being released, such as the ones you just spoke of? Enrollment in VSS. That vss.colorado.gov website is the answer for that. But yeah, and I'm seeing a lot of repeat questions. So as a reminder, the unanswered questions will get carried over to our Q&A document that we will answer at the beginning, or sorry, that we will post at the RFA on December 8th on the VSS website. For today, the recording, the slides, and the transcript will all get posted on the BHA website, and we're hoping that will happen in the next 48 hours here. Just have to get the recording pulled down and talk to the comms team. And from this point on, we cannot directly answer questions. Mark, Joy, myself, that is a state procurement code rule. This is now considered a more or less active procurement, but I am putting email in the chat for Raven Lopez. So you can send emails directly to Raven at this point. Yes, thank you. Wow, I just typed that in wrong. Sorry. Raven. Wow. Okay. I wish there's a way I could delete that comment, but yeah, it's state.co.us, like all of our other email addresses. So thank you all, and I won't keep you any longer. Have an excellent morning.